Hello, this is Dr. Trivedi, a doctor working here today. May I confirm your name and age, please?
Hello, doctor. Good morning. I am Dr. My name is Mila Kunis, and I am 60 years.
Okay, how may I address you?
Please call me Mila.
Okay, Mrs. Miller, today we are going to discuss about your health issues. Is that all right with you?
Yes, doctor.
Okay, and during our conversation, I might take down some notes, which will be strictly confidential. Is that all right?
Okay, doctor. No problem.
Okay, now, Mrs. Miller, can you please tell me in your own words what have brought you here today?
Uh, Doctor, this is something that for the last 2 days I noticed that I am getting my out of breath. I am feeling a little short of breath when I try to do any works. Usually, this wasn't present before, and I started 2 days ago, and it started just suddenly that I was doing some work. Suddenly, I noticed that I feel shortness of breath. Then I went to take rest, but this didn't go away. And also, I think it is even present when I totally do not do anything. That is something worrying for me because I heard my sister. She had an heart attack, and she also had this type of pain. She's this type of shortness of breath. Though I don't have any pain, but I am really afraid if it is a heart attack.
Yes, I can get it. Okay, I'm sorry to hear that, and I will try my level best to find out what's troubling you. Well, you told that it came all on a sudden, and may you tell me that is it present all the time since 2 days back?
Yes, doctor.
Okay, and okay, and can you please tell me that what exactly were you doing when this shortness of breath started?
I was doing some work in the kitchen.
Kitchen. Okay, and is this the first episode that you are having this shortness of breath?
No, about a few days ago, more than a week ago, I also had shortness of breath, but that went on its own, and that persist about for a few hours only.
Okay, okay, and can you please tell me that how is this shortness of breath affecting you now? How much can you work or do your works?
This is very severe because I rarely can do my jobs. I rarely can go out of my bed.
Okay. Now please can you please tell me that are you have to do you have to use extra pillows in your bed for being more comfortable?
No,
Okay. And have you waken up in the last 2 days at night for this shortness of breath?
no.
Okay. And have you noticed that there is any swelling in your legs?
Yes, doctor. This is not a new thing. This was diagnosed about 6 years ago that I intermittently had swollen legs. But I went to the doctor. They did some test for my kidney, for my heart, and they didn't find any problem. And they prescribed me some water pill and told me that to take those when I feel the swollen legs. I needed to take about every 3 to 4 months, and that went away after taking those medication about 1 or 2 days. But this time, that tablet that is name is furosemide, that is helping me. I am taking this for last 2 weeks, but this swelling isn't going away.
Swelling isn't go okay. Can you please tell me is it involved in both legs or say one leg?
More on my right leg.
Okay, but present in left leg also.
Yes, doctor.
Okay, and can you have you noticed that whether you can it's pitted when you put some pressure on it? Have you noticed anything like that?
Yes, doctor.
Okay, okay. Okay, and Is there any pain in your legs?
Some abnormal sense, that is tingling, numbing, and some pain when I press.
Okay, okay, okay. And well, did it come along slowly, this swelling, or start suddenly?
Slowly.
And now, is this always present now, this swelling for the last 2 weeks?
Yes, doctor.
Okay. And have you ever noticed that lifting up your legs or doing anything makes you feel better in this case?
No,
Okay. Anything makes it worse?
no.
Okay. And now about the shortness of breath. Have you noticed that anything that makes you feel better in this shortness of breath for the last 2 days?
Taking some rest makes me somewhat feel better, but that isn't up to my expectation.
Okay. And anything that makes it worse?
Doing what?
Okay. And may I know that do you have any chest pain?
Yes, doctor. Mild pain on my lower chest,
Which side?
mainly on the right side.
Mainly on the right side. For how long?
It's for about 2 days.
Okay. Did it come along suddenly or gradually?
Suddenly.
And has it been present for since the last 2 days?
Yes, doctor.
Okay. Anything that makes it better? This pain.
I took paracetamol that helped me. This pain.
Okay. And anything makes it worse? Have you noticed any coughing or taking deep breath or something like that?
I think I coughed for a few times, and during that coughing, I felt more pain. Yes, doctor.
Okay. And can you please describe the pain for me? How is the pain is?
A sharp cutting like pain.
Sharp cutting like okay. And has this pain gone to anywhere else or just in that right side?
No, it didn't go anywhere.
Okay. Sharp cutting. Okay. Well, can you please tell me that do you have any racing and pacing of your heart?
No,
Okay. Well, another thing about that your chest pain, how will you grade it if I tell you that 1 is the least pain and 10 is the highest pain you can ever experience?
or
Okay. And well, can you please tell me that have you been bedridden recently for any other cause?
no. I was
Okay.
totally.
Have you been to any other? Okay. Have you been to any other long haul flight or something like that?
Yes, doctor. I went to see my sister. She had a heart attack. I told you. She's living in
Okay. Okay. May I know when did you do that? Did this flight?
about 15 days back.
15 days back. Okay. May I know that for how long did that flight exist?
It was 12 hours, but we needed to stay more than 4 hours due to a delay.
Okay. And after coming back, did you notice any pain in your legs?
No.
Okay. And do you can you please tell me that do you have any previous history of clotting problems, blood clots?
Yes, doctor.
Okay. When did it happen?
I needed surgery for my breast cancer, and during that time, I needed to stay in the hospital, and at that time, I had a problem of clotting. That doctor said me that I have clotted leg in my blood channel of my on my left leg, and they
Okay.
gave
And
me
have you been
medication.
okay? Okay. Yeah. Yeah. Well, have you been given any medication at the time?
Yes, doctor, some blood thinning medication for about 4 weeks.
Okay. And since then, have you been taking this medication or has this
No.
problem solved? Okay.
uh,
Okay. That's all right. Well, can you please tell me that? Yeah. Hello.
yes,
Yeah. Okay. And you told that you had some breast problem, breast cancer. And may I know that how was that treated, the breast cancer?
I needed a surgery. That is, the breast cancer was on the left side, and the surgery was they needed a big surgery because it went to the. They said that it went to my armpit, and they also extended the cut. merged into the armpit, and they cleared all the cancer tissue from there. And after that, they gave me radiotherapy and some chemotherapy.
Okay. Okay. And since then, have you been under constant supervision?
Yes, doctor. Then after that, they gave me tamoxifen medication, and I am taking that till now.
Okay. And uh, okay. May I ask you some questions now? Do you have any racing and pacing of your heart?
No,
Okay. Any headache?
no,
Any problems in vision?
no,
Any soreness in your mouth?
no,
Any joint pain?
no,
Any difficulties in swallowing or speech?
no,
Any weakness in any parts of your body?
no,
Any chest tightness?
no,
Any noisy chest?
no.
Okay. Any cough?
Yes, doctor. I told you that I coughed a few times, but that was
Yeah.
very.
Yeah. Have you noticed that that you coughed up blood anytime?
Once I coughed only a small amount of blood, but
When did that happen?
that was yesterday night.
Yesterday night. Okay. Okay. And did that go along spontaneously, or did you notice any more episode?
No,
Okay. Was that frank blood or mixed with your cough? Can
mixed
you
with
please
my
tell?
cough, and the blood was very scanty, doctor.
Very scant. Okay, that's all right. That's all right. And may I know what about your water work?
Fine,
Okay, what about your bowel movement?
fine.
Have you noticed any blood in your stools, bowel motion?
No,
Hello. Okay, okay. And do you have any fever, raised temperature?
no,
Okay, any shortness? Okay, any loss of weight?
no,
Okay, any loss of your appetite?
no, doctor.
Any weather preferences?
No.
Okay, may I know that when your menses stopped?
15 years ago.
Okay, I'm sorry to ask. Actually, it's a very personal question, but I'm sorry to ask. And may I know that how many children do you have?
3.
Okay, may I know that again a personal question? That did you have any history of pregnancy loss?
No,
Yes, that's very good. And may I know that apart from this breast cancer, do you have any other known condition, disease
no,
condition? Okay, and apart from having this tamoxifen, do you and paracetamol at times, do you take any other medication?
no,
Allergy to any medication?
no,
Any over-the-counter medication?
no,
I'm sorry to ask you, do you take any recreational medication?
no,
Okay, I'm going to ask you some personal question. Do you have any? Do you smoke?
no, doctor. Not for
Uh,
for about 10 years.
okay, and do you drink alcohol?
No, 2 minutes remaining.
Okay. Yeah. Okay, and do you have any history of your family of such any breast cancer or any clotting problem?
No,
Okay, and have you been okay? And may I know that what do you do for your living?
I am looking after my grandchildren, and actually I don't do any professional work.
Yeah. Okay. And may I know that? Okay, and may I know that whom do you live with?
Living with my husband, children, grandchildren.
Yeah. Okay, and do you need any help economically or socially? Do you think? Are
No,
you well supported?
yes, doctor.
Yes. Okay, and that's very good. And may I know, do you drive?
No,
Okay, and do you do any swimming or something like that?
no.
Okay, and may I know what your concern is, Mrs. Miller?
Is it a heart attack, doctor? I am really afraid of that.
Yes. And Mrs. Miller, actually, at this moment, we have to at first examine you properly and do some tests. And after that, we can get to you more appropriately about what has happened. But as long as I have taken history, it's likely that there you might be having some clotting issues back again. We are not very sure at this moment, but we will run some tests, some scanning tests of your chest, and also some blood tests. And it might occur that your recent having a long haul flight may
Time
be the
now.
cause of it. And
Okay, got
yes, and again, okay. Okay, I will carry on.
okay. Carry on.
Yeah, yeah. It might occur that your recent long haul flight can may have caused it, or again there are some other possibilities. I'm sorry to say that we might have to check again whether your cancer has reappeared again or not, although it's less chance since you had a very good treatment. And again, another thing is that you have had some medication like tamoxifen, so we might have to review that out as well, whether this can cause clotting problems as well. Okay, clotting problems or not. So we will actually consult with our blood specialist and our consultant also as soon as possible. And after doing the results, we will get to you. And in the meantime, we might keep you. We may have to keep you under observation since it's a clotting problem and your shortness of breath have not faded away. So we might have to keep you under observation. Okay, are you getting me?
Yes, doctor.
Any more questions?
Uh, can I go home, or can you give me some
Well,
medicine where I can go home and
well,
I
well. Actually,
can later?
yeah. Actually, yes, yes. Actually, at this moment, I think it's better for you to be admitted at first and have some treatment. But we will review it later on after getting the test results. Whether you need to stay longer or you can be discharged. Are you getting me?
Okay, doctor.
Any more concerns or questions?
No, doctor.
Okay, so thank you. This is Mila.
Thank you, doctor. Okay, so what is your diagnosis?
Well, I think the diagnosis is pulmonary embolism. I think it can be. I think the diagnosis is pulmonary embolism precipitated by a recent long haul flight, or uh, even the occult breast cancer. The recurrence of occult breast cancer can also be a possibility, and her usage of tamoxifen may also be a possibility here.
Okay. So how will you investigate her?
Yes, at the beginning. Well, in this type of patients, I think we will do some investigations at an emergency basis. Like we will give and also manage her at the same time. We will at first do some D-dimer, and we also send her for CTPA, computer tomography, CT scan, pulmonary angiography, and at the same time we should um give her a prophylactic subcutaneous low molecular weight heparin, so that she doesn't get worse. And at the same time, we will have to do some blood tests like CBC, ESR, CRP, chest X-ray PA view, uh, chest X-ray PA view, and some ECG, ECG, echocardiography of heart, and some clotting profile by doing INR level, prothrombin time, etc.
Okay, you say X-ray. What do you expect on X-ray?
Uh, on X-ray, there can be some possibilities. At times, X-ray can be normal. Then also there can be some possibilities like there can be, I think, um, wedge shaped infarction, I think, present in, in, in pulmonary embolism.
And what do you expect on ECG?
And ECG, I think the most common finding should be sinus tachycardia, and in severe cases, but rarely we might find a specific pattern like S1Q3 T3 pattern.
And
In the lead one, there can be D pace, and in lead three, there can be Q wave and T wave may be present. Inverted T wave.
okay, and what echocardiogram?
Uh, on echocardiogram, I'm not very much sure about that. I'm sorry, I forgot it.
Okay, no problem. And what is there any specific test for pulmonary for diagnosing pulmonary embolism?
Specific test, I think, to rule out D dimer, and then for specifically, I think CTPA.
Okay. And for diagnosing, for you're suspecting that she may have also present a case of she may have deep vein thrombosis. For that, do you want to do any test?
Yeah. I just that is a great mistake. I should do Doppler's ultrasonography of leg.
Okay. Do you have any idea what could be the finding on Doppler?
No, I'm sorry, I don't know.
Okay, no problem. So how will you manage, sir?
I think I think we at first we have to manage the patient at an emergency basis. Uh, First, giving her some injectable subcutaneous low molecular weight heparin if she is stable, and if after measuring her BP and some BP. And but if she is not stable, if we find that her BP is low and she is highly tachycardic, we might go on for immediate thrombolysis. And at the same time, after uh, we will have to uh, we will have to educate the patient, counseling the patient, and we might have to form a multidisciplinary team involving oncologist, involving hematologist, and then map out a plan for how long she might have to continue our anticoagulation therapy. And she might also have to be her medication, tamoxifen might also have to be reviewed, and I think she might have to be prohibited from any recent long haul flights.
Okay. What is your emergency management for her?
Uh, so uh, I think I told you that low molecular weight heparin subcutaneous.
Okay, fine. So coming from the history, I
Yeah,
think your history taking was fine, but your took long time.
yeah.
There was around 17 minutes. You took around 17 minutes.
Yeah, that's I have this problem. I have been facing this. I cannot just complete in 14 minutes. That's a huge problem.
Okay, and another thing that for shortness of breath, onset, then character, associated symptoms, and then timing, eliciting aggravating factor, severity. You went for that very well. And from for associated symptoms, there were chest pain and cough. And for respiratory case, there was swelling, unilateral, more on in single unilateral swelling. And after that, and the relevant history, she had a recent history of taking a long flight. And on the flight, you could have asked that, did you took any specific advice that what should go for, what should you do for when you're going for long flight? She may wear some pneumatic or auto pressing. There are some
Okay.
devices that can prevent from the thrombosis.
Yeah,
So
yeah.
were she aware of that? Because she had
Mhm.
already a history of floating in the past.
Mm. Mm.
Okay, and also it
Mm.
went for the past history very well. That was fine. And after that, drug history, that was fine. And I cannot remember if you asked family history.
Yeah, I asked. I asked.
Okay,
Breast cancer and other air clotting abnormalities. I asked.
okay. Personal history, that was fine. Smoking, alcohol, occupation, social support, or his family support, economical support, social support, driving issue, and recent history of travel and any other travel. Did she have any other problem during other travel also? Okay, yeah.
Yeah.
And on the diagnosis, that was fine. That is most likely pulmonary embolism resulting from deep vein thrombosis. For deep vein thrombosis, her risk factors are recent long flight, taking
Yeah.
tamoxifen, had a history of previous floating. That is also another risk factor.
Mm.
Okay,
Mm-hmm.
already if it is a secondary cancer.
Yeah. Yeah. Mm-hmm.
And after that, there was investigation. In the investigation, I cannot remember if you have said arterial blood gas analysis, his oxygen saturation level,
No, I didn't.
and if needed, we also need to go for right heart pressure if needed. That is not always needed.
Okay. Okay. Mm.
Okay, and on echocardiogram, we see on the pressure on the right heart,
Sorry. What? What?
pressure on the right heart, right sided heart. There,
Mm-hmm.
increased right sided pressure.
Okay. So you're telling that we should do oxygen saturation, blood gas analysis, and also right arterial right heart pressure in echo. Am I right?
Yes, on echocardiogram, we see the right heart pressure.
Okay.
Also,
Yeah.
it's the myocardial infarction. Okay, and
Sorry. Yeah. Okay.
another question and in the management, management for this lady, management is that is she needs hospitalization. On the hospitalization emergency management, that is maintenance like airway, ABCD management, airway, breathing management, circulatory management, because she may have
Mm.
shock.
Mm-hmm.
Circulatory management, management of any
Mm.
disability,
Mm.
just like emergency management, and
Yeah. Yeah.
then if needed.
Mm.
Okay, and after that, that is going for, and now it is said that directly oral anticoagulant are preferred over the heparin injection.
Yeah. 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 Yeah.
Okay, so
Yeah.
DOAC, we will go for the DOAC
Drop.
if
Mm.
he uh, if she
Mm.
isn't any contraindication, and in the meantime,
Yeah.
we will go for the investigations, and all the investigations for the DVT, that is we go for the Doppler study, that is if it is
Mm.
compressible or non-compressible.
Yeah. Yeah. Okay.
Within the vein, the blood clots below the vein, so ultrasonogram
Mm.
probe cannot compress the area. It's non-compressible blood cell, and also
Normally.
flow isn't present. Normally, veins are compressible, but when there is DVT,
Oh,
there
yeah. Yeah. Yeah.
so probe cannot
Mm.
compress that area, and also there is no flow
Mm.
over the area.
Okay. 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 Mm. Okay.
And CTPA isn't an emergency investigation because it is not. We cannot do this test always, but we can at least do the D-dimer, and also sometimes we can go for ultrasonogram earlier before going for the CTPA. And after that,
Okay.
results. calm. If there is any alternative diagnosis, then we will go for the.
Okay, okay,
And
that's all right.
there was some a question about Wales score. I forgot that.
Yes, well score
Yeah.
for for DVT, I think it's greater than or equal to 4, and for pulmonary embolism, for pulmonary embolism, I think it's greater than or equal to 4, and for DVT, I think it's greater than or equal to 2. But I don't remember all the points.
Okay, we'll have to a good idea on that, not to memorize all the points.
Yeah, yeah. Okay,
Okay, fine. You have done well.
okay, okay. So thank you, Dr.